live right now.
Great, thank you.
You're welcome.
All right, good afternoon, everybody. Welcome to the Continuum of Care board meeting. Let's call the meeting to order. My name is Tamara Wright, board co-chair, and I am with Community Solutions. Rob Ferraro, board co-chair, will not be able to attend today's meeting. Prior to the roll call, we will have a moment of silence for Mike McQuaid, who recently passed. As many of you know, Mike served on the Continuum in the past and was so close to many who served on the board. Mike dedicated his life to serving the community and towards ending homelessness. He really exemplified empathy and servant leadership in this community, and I know it's really affected a lot of people, and this is a significant loss. He will be greatly missed, and if you don't mind, we'd like to have a moment of silence in Mike McQuaid's honor.
The one lemonade I haven't finished. Only reason why, because
All right, thank you. Now I will commence the roll call with each board member's name and ask you to introduce yourself and your organization. Ryan Balch.
Yep, here I'm Ryan Balch with the City of Chandler.
Thank you. Eric Cole. Eric, we still can't hear you. Elizabeth DaCosta. Okay, Marshall Franklin. Tad Gary.
Here, this is Tad Gary with Mercy Care.
Thank you. Samantha Jackson.
Hi, everybody. Samantha Jackson, Downtown Phoenix Partnership.
Thank you. Bruce Liggett.
Hi, it's Bruce, Maricopa County Human Services.
Thank you. Joan Serviss. Charles Sullivan.
Charles Sullivan, ABC Housing.
Thank you. Jackie Taylor.
Hi, Jackie Taylor, Save the Family.
Thank you. Dee Dee Devine.
Dee Dee Z Devine, Native American Connections.
Thank you so much. And I see Eric has said he's here, but he may not be able to be heard.
I think, can you hear me now?
Yes, we hear you perfectly.
Perfect.
Awesome. Thank you.
Yep.
Last call for Elizabeth DaCosta or Joan Serviss. I know Marshall's not going to make it today. All right. We will.
Tamara, just an announcement. Joan let us know that she'll be joining the meeting later.
Okay.
I don't know how long, but in a few minutes she should be on.
Okay, great. We'll just go ahead and move on to staff roll call and ask them to introduce themselves. Brandy Mead.
Hi, this is Brandy. Welcome, everybody.
Hi, Brandy. Thank you. And Steve Dudasik.
Hi, this is Steve Dudasik. Happy Monday, everyone.
Thank you. Sarah Kent.
Oh, good afternoon, everyone. Sarah's here.
Thanks, Sarah. Tina Lopez.
Hi, everyone. This is Tina Lopez. Welcome.
Thank you. And Julie Montoya.
Hi, everyone. Julie's here. Good afternoon.
Hi, Julie. Thank you. In addition, Nikki Stevens will present today on the racial equity report. Nikki, please introduce yourself.
Hi, this is Nikki Stevens, Homeless Solutions Supervisor for the City of Tempe.
Thank you. And for all participants, please mute your phone or computer when not speaking, and please do not put your phone on hold, as that puts music into the call and then we can't hear each other. For all participants, we ask that you please identify yourself when speaking. We will be reminding people to do that throughout the meeting, as we have been advised that this is very important for open meeting law. One final housekeeping item, all votes will be roll call votes. I will call the roll call vote after the motion is made. Okay, so we will move on to call to the audience. Please note that members of the public were given an opportunity to submit written comments related to the meeting to azmag.gov/comment within 1 hour of the posted start for the meeting. Next on the agenda is the consent agenda. We have one item on the consent agenda, which is the approval of the minutes from the June board meeting. Is there anyone on the board who would like to request that an item be removed from the consent agenda and considered as part of the regular agenda? Okay, hearing nothing.
Tamara,
Yes.
I'm sorry, I'd just like to acknowledge no comments were received from the website.
Perfect, thank you. Any comments from the board on the consent agenda? And please remember to identify yourself before speaking. Okay, do I have a motion to approve the consent agenda? And please identify yourself.
Jackie Taylor, so moved.
Thank you. Do I have a second?
Samantha Jackson, second.
Thank you. I'll proceed with roll call. I'm Tamara Wright and my vote is aye. Ryan Balch.
All right, aye.
Thank you, Ryan. Eric Cole.
Aye.
Elizabeth DaCosta, if you've joined.
I have joined. Thank you. Aye.
Thank you. Tad Gary.
Aye.
Samantha Jackson.
Aye.
Bruce Liggett.
Aye.
Joan Serviss, have you joined? Charles Sullivan.
Aye.
Jackie Taylor.
Aye.
Dee Yazzie Divine.
Aye.
Okay, the motion passes. Thank you. And next on the agenda is the revised 2020 NOFA scorecard, and we will ask Julie Montoya from MAG to present the revised scorecard. Julie?
Hi, everyone. Steve, are you able to put the scorecard up?
You have permission to put it up, so you should be able to get it.
Oh, okay. Hold on one second. Are you all able to see my screen?
Yes.
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 Okay. Okay. Thank you. Hold on one second. Let me just try to make sure I'm maneuvering here. Okay. All right. Okay. So thank you, Tamara. So MAG staff and board members did get together and met twice to go over this scorecard. We did look specifically at criteria 1B, the no income at entry, 2A, 2B, which was increasing housing stability, and 3A, which was increasing total income. So I don't know if you all have had a chance to look over the scorecard, but as you can see here, 1B is not here anymore. So after the feedback from board members and other providers, we did decide to go ahead and eliminate 1B, the no income at entry, from the scorecard altogether. From feedback from board members, we understood that it didn't hold as much weight as it had did in prior years, as we had shifted to measuring more of the coordinated entry and prioritization that that you can see in 6A and 6B. So we went ahead and decided to just totally eliminate that from the scorecard. 2A and 2B, the increasing housing stability, we looked at adjusting the points and percentage ranges, which we did. Previously, all the points at the top of the range were dropped down by 2s. And so we adjusted that. As you can see, it drops down by 1 until the second half of the scoring, and then it continues by 2s. And then also adjusted the percentages. Previously, it started at the 15 points at 98%, and we dropped that down to 95%, and basically to reflect it to be a little bit closer to the system performance averages, as you can see down here. So we did that both for PSH and rapid rehousing. For rapid rehousing, we dropped that percentage from 85 to 80%, again, to be a little bit more closer to the system performance averages. In addition to that, for 2A and 2B, we added some additional language here. Previously, part of the calculation, we looked at eliminating or excluding, I should say, participants who had passed away during the year. And we added, here, starting here, excluding those persons exiting to a foster care home or foster care group home, hospital or other residential non-psychiatric medical facility, and long-term care facility or nursing home. So that was language that we added in addition to the participants who had passed away. And that was to reflect some of the HUD criteria that had changed. And we had talked about that, I believe, at the last board meeting, but we hadn't seen the documentation. And so thank you, Dee Dee from Native American Connections. We were able to have that documentation showing that it now doesn't show as a negative outcome to persons that are going into these particular destinations. So we added that language to 2A and 2B. And then the last one is 3A, increasing total income. So very similar to 2A and 2B, we just adjusted the scoring ranges and the percentages to reflect more of what we've seen in past scoring. For 3A, for PSH, prior, the top scoring percentage was 60% or more, and we adjusted that to 55% or more. So we just dropped down, again, the percentages to reflect a little bit more of what we've seen average-wise. And then for rapid rehousing here, again, we adjusted from 45 to 40% and then just adjusted the ranges accordingly. And then the other thing we did add to 3A for PSH is here, where it says that not only are we seeing the person gaining income, gaining a source of income by increasing their income, but we added the language to say as well as maintaining non-zero income. So that was to help reflect the persons that are coming in with Social Security or a fixed income, that you're not going to see a whole lot of increasing of income. We wanted to make sure that it said maintaining non-zero income, because we didn't want there to be an issue where it still showed zero income coming in and then still zero income, and that being kind of a not what we're wanting to see. We want to see a increase unless it's a fixed income. So those are the three criteria that that the work group with the board and the staff from MAG looked at and adjusted. Other than that, everything else is the same. So I don't know if anybody has any comments or questions, or if anybody from the board work group wanted to add anything to what I already talked about.
Any questions or comments from the board members?
Tamara, this is Dee Dee. Hi. Julie, thank you so much. You really captured everything and explained it, pretty complicated things very easily. So great job. Thank you for capturing that and being able to explain it. Thank you very much. The only thing that we had spent quite a bit of time about a bonus question for race and equity.
Yes, thank you. I had forgotten about that. So that was one of the things that was brought up at the board work group, was adding a bonus question for a racial equity action plan for providers. We had a quite lengthy and a healthy conversation about that. Dee Dee, feel free to jump in here. I think ultimately we do feel moving forward that this is something that we want to make a priority but also didn't want it to be something that providers just put together, just to get a point or two on the scorecard. We wanted it to be thoughtful. And so ultimately we decided that moving forward, that'll be probably something we'll add on the scorecard for next year. And this year, if we do have a regular process, that we're gonna look at adding discretionary points as part of the interview process. So was there anything else that I left out there?
No, actually, Julie, thank you. You did a really great job. I do want to make sure that we continue the discussion about the discretionary points and that it does become meaningful in next year's discussion, because I won't be on the board, and I just want to make sure that that gets captured for next year.
Thanks, Dee Dee. Any other questions or comments from the board? All right, great work, Julie. Do I have a motion to approve the revised scorecard?
Jackie Taylor, so moved.
Thank you, Jackie. Do I have a second?
Eric Cole, second.
Thank you so much. I will proceed with a roll call. I'm Tamara Wright. I vote aye. Ryan Balch.
Aye, and thank you, staff, for working so hard on this.
Yes. Eric Cole.
Aye.
Thank you. Elizabeth DaCosta.
Aye.
Thank you. Tad Gary.
Aye.
Samantha Jackson.
Aye.
Bruce Liggett.
Aye.
Joan Serviss, are you on?
I am. Aye.
Thank you, Joan. All right. Charles Sullivan.
Aye.
Thank you. Jackie Taylor.
Aye, and also a big thank you for the opportunity to focus on this together.
Yes, thank you. And Dee Dee Yazzie Devine.
Aye.
Thank you so much. The motion passes. All right, next
Tamara,
up. Yes.
Tamara, before we move on, I really feel strongly about reflecting in the minutes. We've just passed the scorecard, but we did have a very considerable discussion in our work group about a race and equity bonus point. So I want to make sure that it's reflected that we will continue to discuss it as part of discretionary points for this year and making it a meaningful point next year. So I want to make sure that gets captured somehow in the minutes.
This is Steve. It will be reflected in the minutes. Thank you.
Thank you.
Yeah, I second that comment and suggestion.
Absolutely. Thank you, Dee Dee. Okay, next up is the NOFA rank and review, and we're going to ask Julie to continue to present and talk us through the rank and review.
Okay, can you all still hear me okay?
Yes.
Okay, so I will say that I didn't make any changes. This is the review, rank, and reallocation process from last year with just updated dates. And part of that was, again, because we don't know what this year's NOFA is going to look like. We do anticipate that HUD will be finalizing a reduced process this year, and we don't quite know what that looks like. And so we didn't want to put too much work into changing this when we're not really sure if this is really the process that's going to occur. And so I don't know if you all have gotten a chance to look at it. It's like I said, the same as last year, basically 3 phases of the process, which includes the scoring materials, the rank and review subcommittee, the appeals process, all of that. So I didn't plan on going through this document really today because I believe that we're not going to approve it today. If we do hear from HUD before next board meeting that that we will be having a full competition, that we'll be able to, you know, have this go through the board for approval. Am I correct in saying that, Steve?
Yes, that was the thinking about not bringing this up for action today, just to get it on the agenda and have a chance for the board to comment on their reading of it.
Thank you. So this is not on the agenda for action, so we're just going to move on after this if there's no questions or comments. Okay, next we will move on to a discussion of racial equity, beginning with a report on the work group, and Nikki Stevens will be leading this discussion. Nikki?
Hi, everybody. So I'm not sure what was the last update given in regards to the racial equity work group. On July 7th, we met, and at that time, there was the survey that was put out to the community that MAG shared as well was given to everybody. So we had 240 responses, and now the survey is closed. And we have completed the community stakeholders work groups as well. So right now they completed, 2 others are scheduled. The community stakeholders are complete, but there are 2 other meetings are scheduled, or 3: families, single adults, and youth. So UMOM's participating. I think that's already been completed on July 20th. Single adults was completed on July 23rd. Native American Connections was going to do a youth one, and that was scheduled for the 23rd of July as well. So
it was completed, Nikki.
Oh, it was completed.
They had the youth. It was UMOM and Native American Connections in 1 and 10.
Okay.
And they had it last week.
You know if the Human Services campus was able to complete theirs for the single adults?
I don't know that. I just know that we were involved in scheduling the youth, and it was completed.
Okay, so that's great. That's great to hear. So Jeff and his team are gathering the qualitative and quantitative data to do an analysis for our community. And we hope to have that information beginning like next month. We should have a lot more information to provide to the community. Our next meeting is scheduled for August 4th. And at that time, we will continue to discuss next steps moving forward. Does anybody have any questions for me? Okay, well, thank you guys. I appreciate you allowing me to join you.
Thank you, Nikki.
Hang on, I do have a question. I mean, it's probably not for you, Nikki, but I know that there's already discussion about a phase 2. Can we get an update on that?
Well, I know that there should be a phase 2. I want to say beginning September. Julie may have more information on that so that they can start giving us additional feedback in regards to what they're going to be doing with that information, and also provide the board and the communities with strategies moving forward.
Yes, that's correct, Nikki. And indeed, to your point, yes, the phase 2, Julie and I have been in touch with our consultants, and the idea is this: they'll continue their work beyond September 30th. And moving on to more recommendations and action steps based on what the information they're already gathering. And I would imagine they're going to take a look at systems and practices at that point in time and inform the board, and actually, work with the board in regard to training in terms of implementing a racial equity plan across the system. So that's the idea. And Julie, if you have anything to add on that, we're actually pretty excited that they were able to stay on with us and we were able to provide that to them. So.
Nope, that sounds great. I don't have anything additional to add.
I would, hey, it's Eric. Dee Dee mentioned earlier kind of some of the conversations that came out during our work on the scorecard. And I think it was really fruitful, and folks were real honest and even vulnerable about kind of what their organizations, kind of navigating their way through this topic and this really hard, this important and really hard work. So I was pleased, and I think I'm sure the committee is discovering this as well, but like agencies seeking and leaders seeking, capabilities and the right set of tools to kind of grapple with this question in a meaningful way. So I think that's, it's positive momentum for us on racial equity as we, continue through phase 1 and into phase 2. So I would just throw that in there for my 2 cents.
Yeah, thank you for bringing that up, Eric. So I'm really looking forward, been doing research on my own, but really looking forward to meaningful tools to advance the conversation, both at the board level and my staff level. So appreciate your leadership in that, Nikki. And as I've said before, you and Dee Dee both have been major mentors for me in this area. So I can't thank you enough for being part of my life.
Thank you, Jackie. I appreciate you continuing the conversations for yourself and for your staff. So thank you. I appreciate that.
Thank you.
All right, thank you, board. This was not on the agenda for action, so we will move on to the next item with a legislative update from our board member, Joan Serviss from the Arizona Housing Coalition. Joan?
Guys, do I have a time limit? I ask because I could go on for a while. So just someone yell at me to stop. So I'm just going to focus at this federal and state level. Well, I'm going to talk a little bit about local, but state level, everything at the legislature is on hold. Obviously, they've recessed and the elections are coming up, and so that'll dictate what's happening next legislative session. And maybe we can advance more of our legislative priorities next legislative session. But just because the legislative branch is kind of in transition, the executive branch is moving forward on being responsive to COVID-19 to a certain extent. And, the Department of Housing has pushed out their eviction prevention program, and there's plenty of other rental assistance programs that are occurring. We all saw the eviction moratorium continue to October 31st. And we've also probably seen hopefully y'all have seen some announcements from the governor's office about additional funding, some of which was from the work that you all did in advocating for the Crisis Contingency and Safety Net Fund that was passed by the state legislature right before they adjourned. So there's about 20 million of that $50 million left. And it's, kind of a recent distribution was about $5 million to set up support for small landlords who have been kind of navigating this eviction moratorium as well. So this, as we have many landlords on the phone, we have to be supportive of the supply and the demand side and make sure that that our friendly landlords and our landlords of some of our natural occurring affordable housing, that they don't give up and sell their property. And then we have a whole bunch of investors swooped in like they did last housing downturn. So that hopefully that fund will protect those folks. And then we have that protection for the tenants in place till October 31st. But all that being said, I want to be real clear that continuation doesn't mean that landlords and tenants shouldn't be speaking to each other. In fact, we really need to strengthen the communication. And kudos to Joanna Carr on our team, and then Community Legal Services for putting together toolkits and repayment forms, et cetera, to strengthen that communication between landlords and tenants. Because landlords do need to take action and communicate with their tenant, or I'm sorry, tenants do need to communicate with their landlords if there's a COVID-19 impact. So that's that. I wanted to highlight, continuing on the state level conversation, I wanted to highlight that the Department of Housing is set to issue their qualified allocation plan for the low-income housing tax credit program. That'll be that first draft will come out August 14th. The coalition is going to be holding work group calls to solicit some feedback on that, and ultimately really try and strengthen the really strengthen the need for affordable housing. And hopefully, I know Dee Dee has brought this issue up before, that the timeline should really match and be supportive of the federal process here, the homeless assistance grants, the COC funding process. So it'd be great if that could be matched up. So I'll pause and see if anybody has any questions on the state level conversation first. Okay. Oh, Dee Dee.
Joan, I was just going to say, if there's, I think most people that aren't really involved in the QAP and kind of that housing development world don't know how those points really affect affordable and homeless housing. And if there's some interest, I'd be happy to, you came on just a little bit late, but Ryan was sharing some medication advice, and, I'm just having some good sharing about really some of the things in the QAP that highly affect the work that we do on homelessness, because I don't think it's really clear. It's so complicated. So if there's a group of people that want to get together and kind of talk about that so that this group could make some meaningful comments, I'd be happy to be part of that.
I would love to learn more about that, Dee Dee. I don't know a lot about that, and I've always wanted to. I would love to take you up on that.
Second that too. This is Tad.
This is Tamara. I would love to learn too.
All right, Dee Dee. Well, I smell a coalition webinar with you at the
Yeah.
Okay, well, fantastic. Moving on with the federal update, the coalition had a couple great virtual meetings with Senator McSally and Senator Sinema's office last week. We were pushing for 3 priorities focused on getting more rental assistance as it relates to the pandemic, as well as pushing forward some of the low-income housing tax credit priorities that both senators have supported in the past and that we feel should be included in a coronavirus relief package. And then obviously, of course, additional funding for the emergency solutions grants. The feedback from, I'm trying to remember, it was only a week ago, McSally's office was actually, Senator McSally was there. She was on the call. Most of the conversation with her was focused in on the low-income housing tax credit program and rental assistance, because she, because of her position within the party and what she can advance, we really focused in on the fact that we need the supply side as well as the support side, but really focused on the fact that she has indicated an interest in advancing the affordable housing narrative, pushing more units online. With Senator Sinema's office, we met with Michael Wong and Sylvia Lee. And if anybody's ever met with Senator Sinema's office, Michael Wong is amazing. He's so smart. He's such a good guy, Arizona native, I believe. And it was a good conversation. But I will share that, anytime we talk with Senator Sinema or her office, it's a tempered conversation. They're very much realists. And, when we talked about emergency rental assistance, it has been floated from some of the national groups, $100 billion, and I say billion, and that causes some pushback from, it's a big price tag. But the senator's office was really supportive. I mean, she's signed on to many pieces of legislation around housing counseling, around the low-income housing tax credit, around the emergency solutions grant, rental assistance, as well as the Family Stabilization Act. So Senator Sinema, there's not a lot of convincing there. Nonetheless, good conversation. And then we're also kind of waiting on bated breath. Apparently the GOP is supposed to be releasing their CARES Act version 4 stimulus package later on today. So watching and waiting for that. And then of particular interest, and again, admittedly, I need to do some follow-up because this occurred last week. Some of it was we should have been better prepared for, but a couple of issues have come up that we really need to take action on. The first being that I think you all remember back in 2019, we reported that HUD was going to propose a rule that would weaken their enforcement of the equal access rule. And the equal access rule protects transgender people from discrimination in shelters. by really, saying that people can access shelter consistent with their gender identity rather than their sex assigned at birth. So this new change would allow homeless service providers to consider privacy, safety, practical concerns, and religious beliefs when making a determination about if and how to house people seeking services. So that's of grave concern, obviously. And I will share that the Housing Coalition is utilizing the national group, which is actually it's a conglomeration of groups like True Colors, National Alliance to End Homelessness. It's a website called Housing Saves Lives, and they are soliciting comments to submit to HUD with this proposed rule. So we'll be sending out an action alert to drive traffic to that and encourage folks on the phone to submit comments to that effect. I'll pause and see if anybody has any questions and comments. And I will share that this issue plus the next one, I think the coalition needs to do something about besides pushing traffic. I just don't know what it is. So I'm open to feedback, but I'll pause first on this issue and see if anybody has any questions or comments.
I'll just say one thing. I think it was amazing that you had Senator McSally herself on your calls, and that your lobby days were very well attended, and I could tell that you had certain speakers to really highlight certain items that each senator had worked on in that office. And I just felt like that was really outstanding. And I think you and your staff did an outstanding job on that. And I just wanted to congratulate you on a job well done.
Appreciate it.
I just had a question, Joan, and this might be completely unrelated, so just say so. I saw something, gosh, it must have been Friday. I haven't looked into it, but it said they're putting out a change to fair housing.
Yep, so that was the second point that I wanted to bring up.
Thank you.
Yeah, no, go ahead.
No, I wanted to know more.
Okay, and this is where I'm struggling. I really need to do a better job of reaching out to the folks that I lean on locally, which is this Jay Young at the Southwest Fair Housing Council. But to that end, Ryan, what Ryan's talking about is that the Trump administration, or HUD, has basically abolished the Obama era affirmatively furthering fair housing. And basically instead they're proposing a rule called preserving community and housing choice, which is kind of a very broad, look at what is fair housing, whereas the affirmatively furthering fair housing, that act required federal agencies to work alongside localities receiving any kind of federal assistance, the really deliberate action to undo decades of federal, state, and local discriminatory policies and practices. These localities must address local policies that illegally discriminate against residents. Further, they must show that they're ensuring that all neighborhoods have equitable access to high quality schools, healthy foods, clean air and water, transportation, quality healthcare facilities, and other community resources and amenities. Now, I'm sorry, but the timing is way suspect. I think we're all a little hyper vigilant about kind of any repeal to, we should be adding these filters and instead of peeling them back. So to be honest, I don't know the next action. Again, I need to reach out to the Southwest Fair Housing Council, but I'd love to hear anybody on the phone or on this call from a locality perspective, Ryan or Bruce.
Well, I was in fact shocked when I saw it, although there had been whispers about it. As a locality, spending and allocating community development block grant funds and other, similar funds, we're required to ensure that our residents have access to fair housing education, counseling, opportunities to, and, assistance making, filing a grievance, discrimination testing in our community. And so, I have a piece of a position funded for that. We certainly work with Southwest Fair Housing Council, but we've gone our own way in Chandler just because they're not housed here, and it was hard to get them up here as adequately as we wanted. So, you know, we have infrastructure around this, and, you know, the complaints come straight into my office. So I hear them. I know there's still housing discrimination out there. It happens every day. And, you know, I'm sad. I'm saddened that, that we're undoing this, because I feel like we've just barely skimmed, you know, we're just barely scraping by what the extent of the issue here, and starting to get our arms around what can we do about it. And so to see it go away, I don't know what, I mean, does that all just end? Or is it just no longer a requirement? Are we allowed to do that with our dollars? I just don't know. I have all of those questions.
Yeah. I mean, the narrative that's being purported is that, you know, it was burdensome and onerous. And, you know, I mean, we hear this talking out of both sides of their mouths. The federal government shouldn't be telling localities what to do, but I digress. Bruce, can I put you on the spot?
No. Yeah, no, I don't, it's hard to respond. It's part of an agenda that over time is rolling out and getting down to these levels. I mean, over the years, we get an occasional issue where this provision is brought up by a local, since we work with local communities as part of a Washington desire to shape each community and their own view and all that. But it's really not onerous. And it does fit with, as Ryan said, our role in terms of taking and hearing about complaints. Mm-hmm. So it's gotten more attention on the negative side than I think we've been able to point to things that we've done that are positive in terms of it. But I mean, I haven't paid much attention to this process because what the administration wants to do, they seem to be just getting done through executive orders and such. So hasn't been burdensome for the county.
Good. Thank you for that feedback. I do recall before, you know, as Ryan mentioned, this had been hinted at. I think it was Congressman Gosar had a strong reaction against the when it was first introduced back in 2015, I think it was. So I remember him wanting to peel this back. So this has been hinted at because there's not a comment period. You know, the repeal of the equal access shelter, that is a public comment period, so we can take action, we can rally the troops and submit comments. This is basically, you know, already mandated. However, you know, maybe we can use some opportunities of meeting with our congressional members and asking them to champion this issue. But to that point, look for, I really value your feedback. If you guys have any thoughts on this, I'd love to hear it, but the coalition would like to stand opposed to this. I will be reaching out to the Southwest Fair Housing Council to see what they are doing and kind of probably mirror what they're doing as well. But I'm also open to any feedback from you all.
And honestly, Joan, if you get any information, just, I mean, even logistically, like, I mean, I have, you know, when it comes to community development block grant funds, you know, we're all putting these things into our consolidated plans. There are goals around them. So, I mean, I have an activity that is fair housing that is funded. And so I'm wondering, you know, is that still an eligible activity? Is it just no longer required? So if you hear any logistical stuff about that, I'd be interested in knowing.
Fair.
Thank you. Thank you, Joan. Did you have anything else, Joan?
Just lastly, just that we're watching the federal budget process. Not only are we watching the COVID stimulus package, but, you know, the House passed their version of a spending package for next year. We're waiting to see what the Senate does. And as soon as we know more, we'll share.
Thank you so much, Joan. And again, just a great job with you and your staff and all the work that you've been doing around advocacy. We'll move on to our next agenda item, which is comments from the board. So is there anyone on the board that has any announcements or events they would like to highlight? Oh, I'm sorry, I skipped something. Do board members have any action or discussion items for the August agenda?
I forgot to say one thing on the local level. Was there a conversation already around the City of Phoenix homeless plan and survey?
No, there wasn't.
No, I'd be interested in that.
Okay, so I know that the City of Phoenix is doing, they're doing extra small group presentations, both out in the community, but also I would imagine they present to this Continuum of Care board. So I would encourage, maybe we can reach out to them to ask them to present next month.
Thanks, Joan. We reached out to Ty to talk about the database, the shelter database that they were asked to create. And then we also reached out to maybe Marshall to have her present on the homelessness plan. And the original intent was to have it be on this call, but we're going to wait till the next meeting in August and hopefully have them both present on those items. Is there anything else that we would like to make sure gets on the agenda for August? All right. Are there any announcements or events that anybody would like to highlight?
I'd like you, go ahead.
Bruce, I just want to mention, I don't know what when the last update was. There's been so many updates. It's been a while here, but we were able to secure an additional evening weather relief option in downtown Phoenix. So Phoenix is operating its daytime heat relief at the convention center, up to 200 people. On hot days, they serve many more than that in a day. The One West Madison location, site of the former grand jury where they used to meet, just became available weeks ago, and we jumped on its availability. It can hold up to 130 people. The Human Service campus is staffing it for us, and I think the maximum we've had there is 60. So with that, and with the LDRC on the campus being available for up to 47 people, and St. Vincent de Paul being able to accommodate 80, sometimes a few more than 80, we've got evening heat relief available up to about 250 people, which was the average number of people who used heat relief last summer pre-COVID. So we were much slower to start this up this year because of COVID and having lost shelter capacity. But that's in place, so we're pleased. And most people on the tent lots are taking advantage of those during the day and evening. There's been some attrition in the tent lots. We're starting to have discussions about what an ultimate exit strategy might be. So much hinges on the timing of this pandemic, which nobody can predict. So at this point, we're definitely going to be operating, as is Phoenix's heat relief, by the way, is available through September for both the city and the county and what the campus is making available. But this is looking increasingly like the tents are going to be there beyond October 1st, probably through the calendar year, although we've made no decisions about that. Anyhow, we keep, that's been a challenge to operate. I think that's it, unless there's any questions about what you're hearing about in terms of the county. You know, we acquired an alternate, one of our hotels in downtown Phoenix was being used for people who were under investigation or positive. We've relocated that service up to the Phoenix Inn on the I-17 around Northern. CNN did a story on it that caught us all by surprise, but it was very positive. It was a nice story that apparently one of the people staying there connected with CNN. So there's that, but we're really pleased that Native American Connections is now opening the place that was for positives. It's called The Lodge, and they've got it full and people and getting housing plans for people. So it's really exciting. There's positive things happening.
Can I just add to that, Bruce? So we just opened a couple of weeks ago and taking referrals that have been assessed down at the Human Service campus by Circle the City, who have very high risk for COVID, terms of medical complications, their age and other things. And we've just been open a couple of weeks. We've already made 2 permanent housing placements, people just coming in temporarily. So our goal is to turn that several times to get them off the street, keep them safe. But we've already made 2 permanent housing placements in just the first 2 weeks. So
excellent. Yeah. And even the thing, so with a little bit of attrition at the tent lots, we're taking advantage of it, working with Amy Schwabenlander in the campus and saying, you know, maybe we should be looking at a little more engagement. What we opened there was a safe space that had water, toilets, security, and people are pointing out to me that we opened up a lot in the middle of the summer in Phoenix, and we knew that. And so that's why heat relief was so important. So we're getting a lot of really creative names for the place emanating, but we're really talking with, Amy's got a lot of ideas about how if we added a few staff to help us with the people in lots as we someday phase it out and have an exit strategy, what could be retained to really strengthen the coordinated entry system as part of that. So with all of us, I know we're trying to say this is like, it's crazy now, the amount of resources that are coming in and the time we have to bring things up, making it up as we go, figuring it out. But what can we do that's going to have a lasting effect? And so there may be some really positive things to continue beyond the tents.
Thank you, Bruce.
Any questions about what people are hearing about the county or the hotels? Things change. Our Mesa hotel got sold and we had to move to a different model. We had a hotel in Mesa where we were serving people who were being case managed by Mesa, Chandler, and Tempe. And we have individual arrangements now with each of those cities for hotels in their community, which is a better regional approach, probably anyhow. But things are changing on a week-to-week basis. So
I would just mention, Bruce, too, that like I think what Dee Dee was saying, you've had 2 permanent housing. I was just looking at our outcomes from our hotel rooms, both in Mesa and since we've transitioned to Chandler, and we're having fantastic outcomes. It's so great to just have someone in a hotel all day long being healthy and safe. We can feed them, we can find them, we can talk to them at any moment in the day. They trust us because we're always there. I don't know what I did with them right now at this moment, but we had, I think since we opened, 3 permanent housings, 3 diversions, like 2 or 3 people have gone into like long-term addiction recovery. I mean, we are moving people through there to really positive outcomes. It's amazing what that roof will do, you know? So I hope that it's a strategy we might continue to use in the future.
Hi, it's Nikki. I know I'm not supposed to talk right now, but I wanted to thank the county as well because we've gotten really a lot of positive outcomes as well to be able to have a safe place for people to be, as Ryan mentioned, with food and medical. And, you know, we have people in wheelchairs. We have a blind gentleman. So thank you, thank you, thank you. And we're moving them positively out as well.
And these are just folks that can't really do like a mass shelter situation for, you know, all kinds of reasons, but we're finding that we still very much can get to a positive outcome with them and very quickly. So yeah, thank you, Bruce, for supporting us in this. We have a lot, we're learning a lot, and I think it's going to be something we're going to look seriously at in the future.
Hey,
Thank you so much.
sorry.
I have one suggestion for folks that are tracking their outcomes to really to make sure that you're tracking that data and writing it down and painting that picture. So that way, when we have like our funders come together, we can say, this is why we need a lot more funding for bridge housing. So we can find people, we get exits more quickly, and then having that data to back it up would really be outstanding.
Yeah, it's Eric. I was gonna echo that. Like the more narratives and like learning we can take away from, you know, what is it? This is like a experiment that none of us thought was gonna happen, and it's been forced on us. It just really is a incredible work that the system has done, and I'm so appreciative of all of you. I think back to when we started our weekly calls, and you know, I think a lot of that work early on from the planning perspective it really paid off as we've kind of gone back into a much more serious situation right now. So kudos to everybody.
Yeah.
Tamara, if there is a standard set of outcomes that you recommend for bridge housing, that would be great. I'm using what what I think is necessary, but this is not like a program in HMIS it is and it isn't. So I wonder if there is a standardized set of outcomes that we might look at for bridge housing.
Sure, I can find some stuff.
That would be great. And then we could collect the same data.
Yes, I'll get on that. I'll find something.
Be happy to use that. Yeah.
This is Tad too. One, just want to echo all you guys' work. Like everyone on this call, some amazing things are coming out of this pandemic. There's sometimes when you have a crisis, great work ends up happening around making some really important changes. So really want to thank you guys for all that work. With that, I was wondering too, like from a healthcare perspective, I know because I've been tracking some of this work, and we have here in Maricopa County in particular have contracted providers connected to a lot of these projects, but where you guys might need some support or assistance in any of, to be able to really address the whole health needs of these individuals, I'd be more than happy to help support in any which way I could on that, because I think that's another iteration to this. I know already some good work has been done around that with partnerships and stuff, but where you guys may need some support, I want to definitely offer that up and help where we can. So
much.
The only other thing I'd say, just to Joan mentioned it in terms of rental assistance program. So some of my effort has shifted from some of the homeless work into bringing that up, and so we launched our program on the 15th, and by the 17th, several media calls demanding how many people had applied, how many people been denied, how many people were waiting. So there's quite a bit of, it's all about COVID with the media now. And so anytime we bring up anything, there's lots of people, even national outlets, asking all kinds of questions. So I think our public information office has gotten over 600 inquiries in the past 2 months. So the media aspect of this is quite time consuming, but part of the job.
So Bruce, I'd be remiss if I, this is Dee Dee, if I didn't say on the COVID testing side, the county's really stepped up too. So we've already had, we tried to bring people in COVID free when they came into the bridge housing, into the lodge. But we've already had a gentleman, and who's in a wheelchair, test positive, and the response to get him to isolation facility that's going to really take good care of him and bring him back to the lodge. We've been doing that at our treatment center, but the county has been really, really responsive to testing, and the testing results are coming back relatively quickly, and so they're meaningful. And I just want to say that stand-up job on the testing side as well.
The public health people have been really great about that.
They've been really good. Yeah.
Well, and I'd also like to say that, those of us that tuned into the director of the USICH, one of the big concerns that's coming is the oncoming flu season and the danger that poses when partnered with COVID. And we've already, and I hope many other agencies as well, have had outreach from the county to consider our agency, our headquarters, as a site for vaccines. So that is just really awesome.
We get asked a lot, and I've been trying to, the press wants to know how many homeless people have COVID-19. And anytime we try to explain, that's a difficult number because we don't know every homeless person. It's what's your definition of homeless? And so there's a lot of pushback thinking that the county should do that. The county public health does get a report. There's a marker anytime there's a positive, so we're tracking positives. And so hospitals can check a box that says homeless. And so And there's obviously some agencies, Circle the City, providing tests that we know they're working with homeless people, but the number 400, over 400 is out there. I wanted you to hear it first, but I have not put much credibility into it because somebody goes to see a doctor, they say, oh yeah, I'm homeless, but I'm living with my family and all that. So it's not a precise number, but it's out there. And any number in this field, as you know, that says, well, how many have been tested and how many, and that's not tracked in terms of tests and positive rate for homeless. But at least 400 people who self-identified or were identified as homeless since the beginning have tested positive.
Thank you, Bruce. And I just want to say, like, some of our permanent supportive housing providers also had testing on site to really exemplify human-centered design and bring the services to people that are highly vulnerable. And then in addition to, the county worked out an agreement to make sure that people experiencing homelessness, if they were tested for COVID, that their results were prioritized. And I just think that, like, some of the work that the county is doing and all of our providers are doing is just really outstanding, and it's very humbling. And I'm just very proud to be part of this community with a bunch of game changers. So thank you so much.
Yeah, thank everyone.
Yeah.
Thanks.
With that, we are 2 minutes over. This was going to be a 1-hour call today. So if there's no other announcements or events, is there a motion to adjourn the meeting?
Eric, so moved.
Thank you, Eric. We have a second?
I can do a second, Samantha Jackson.
Thank you so much. All right. I'm Tamara Wright, and I vote aye. Ryan Balch? Eric Cole?
Aye.
Elizabeth DaCosta?
Aye.
Thank you. Samantha Jackson?
Aye.
Bruce Liggett?
Aye.
Joan Serviss? Charles Sullivan?
Aye.
Edie Yazzie Devine?
Aye.
Jackie Taylor?
Aye.
All right, thank you. The motion passes. Thank you so much, everybody.
Thank you, everybody.
Bye.
Thanks, everyone.
Thank you.
Thanks, everybody.
Bye.
Bye, all.